If you've been told you have Sjogren's syndrome, the explanation probably went something like this. It's an autoimmune condition. It causes dry eyes and dry mouth. We'll manage the symptoms. And if that's all you got, you weren't told the whole story. Sjogren's isn't a dryness condition. It is a systemic autoimmune disease that can reach nearly every organ in your body. And the fact that most people, including many doctors outside of rheumatology, still treat it as a minor inconvenience is one of the biggest problems in autoimmune medicine right now. By the end of this video, you'll understand what Sjogren's actually does to the body, why it takes so long to diagnose, and there is one body system it attacks that almost no one tells patients about. Stay with me on that one. And if this kind of content helps you understand your health better, hit subscribe. We do this every week. What is Sjogren's actually? It's an autoimmune disease, which means your immune system, the one that's supposed to fight infections, has turned on your own tissue instead. In Sjogren's, the primary targets are your exocrine glands. Exocrine glands produce secretions, tears, saliva, mucus, the fluids that keep your body's surfaces moist and protected. Your immune system sends inflammatory cells into those glands and damages them over time, which explains the dryness. But the inflammation doesn't stay put. It moves. And when it moves, Sjogren's becomes something far bigger than dry eyes and dry mouth. The most common systemic symptom is joint pain and swelling. Around 70 to 80% of people with Sjogren's deal with arthritis-like symptoms. Aching, stiffness, swollen joints, particularly in the hands, wrists, and knees. That's not coincidence. That's the same immune dysfunction driving inflammation in multiple places at once. The second major systemic feature is fatigue, not ordinary tiredness, the kind that doesn't improve with sleep, that grinds down your ability to work and think and function. Patients consistently say it's more debilitating than anything the dryness does to them, even when the dryness is severe. Sjogren's can also affect the skin, causing dryness, rashes, and photosensitivity reactions. It can reach the lungs, producing a chronic dry cough, shortness of breath, or in more serious cases, interstitial lung disease, where inflammation is damaging the lung tissue itself. It can disrupt how the kidneys regulate acids and minerals, a condition called renal tubular acidosis, and it can cause vasculitis, where the inflammation turns directly on the blood vessel walls. Now here's the one that trips everyone up, and this is what I promised you at the start. Sjogren's can attack the nervous system. This is called neurological Sjogren's, or neuro-Sjogren's, and it is dramatically under-recognized. It can affect the peripheral nervous system, the nerves running through your arms, legs, hands, and feet, and in some cases, the central nervous system, which includes the brain and spinal cord. Peripheral neuropathy in Sjogren's shows up as numbness, tingling, burning, or weakness in the limbs. Patients describe it as pins and needles that won't stop, or the feeling of walking on gravel when there's nothing underfoot. Central nervous system involvement can drive cognitive symptoms, what patients and clinicians now call brain fog. Trouble concentrating, memory slips, can't find the right word, mental exhaustion sitting on top of physical exhaustion. If you've been struggling to explain why you can't think clearly, and no one has ever connected that to your Sjogren's, this is why. The nervous system is a target. It belongs in this conversation. One more thing worth knowing. Sjogren's doesn't always travel alone. When it occurs by itself, it's called primary Sjogren's. When it appears alongside another autoimmune condition, rheumatoid arthritis, lupus, systemic sclerosis, it's secondary Sjogren's. In those cases, the picture gets complicated fast, because you're managing more than one immune problem running at the same time. So why does this take so long to diagnose? The average time from first symptom to a confirmed Sjogren's diagnosis is somewhere between 3 and 7 years. 3 to 7 years. That's not a rounding error. That's years of someone's life spent without answers. The symptoms are scattered: fatigue, joint pain, dryness, brain fog. They fit dozens of conditions, and they tend to be assessed in isolation rather than as a pattern. The ophthalmologist sees dry eyes. The dentist sees dry mouth and repeated cavities. The neurologist sees numbness in the feet. Nobody connects the dots until enough symptoms pile up, or until the patient connects them and finds their way to a rheumatologist. The blood tests that help confirm Sjogren's are the anti-SSA antibody, also called anti-Rho, and the anti-SSB antibody, also called anti-La. These are the most specific markers, though not everyone with Sjogren's tests positive for them. A lip biopsy, A small sample from the minor salivary glands inside the lower lip can also confirm the diagnosis by showing lymphocytic infiltration, immune cells clustering inside the gland tissue. If you suspect Sjogren's, a rheumatologist is the right specialist. You can ask specifically about these antibody tests and whether a biopsy makes sense in your case. There's no cure for Sjogren's yet, but there are treatment options worth knowing about. Hydroxychloroquine, the same medication widely used in lupus, originally developed for malaria, is commonly prescribed and can help with fatigue, joint symptoms, and overall immune regulation. For significant organ involvement, stronger immunosuppressive medications may be needed. For the dryness itself, options have improved. Dedicated eye drops, medications that stimulate saliva production, and protective strategies for the teeth and eyes. The lifestyle side matters too. Sleep is not optional. Disrupted sleep worsens fatigue, pain, and cognitive symptoms in ways that are well documented in autoimmune disease. Gentle movement helps with joint stiffness and immune regulation. Stress drives cortisol dysfunction and can trigger flares, so managing it is clinical reasoning, not soft advice. Reducing ultra-processed foods and including omega-3 rich sources has supporting evidence across autoimmune conditions broadly. And finding a community of people who actually understand what this disease feels like, that matters more than it sounds. If you came into this video thinking Sjogren's was mostly about dry eyes, I hope this changed that. It goes after glands, joints, lungs, kidneys, blood vessels, and the nervous system. It takes years to diagnose because its symptoms scatter across different specialties, and nobody puts them together. It deserves to be taken seriously by clinicians and by patients. Share this with someone who's been told it's not a big deal. And watch this next video to keep building your understanding of how the immune system connects to everything.